Good afternoon. I'm Patty Johnson, coordinator of the Southeastern Council of Foundations EngAGEment Initiative. This afternoon, we're delighted to present our program, Grandparents Raising Grandchildren, Fostering Community Support. It is sponsored by the Jessie Parker Williams Foundation and presented by Mary Judson, the Executive Director of the Jessie Parker Williams Foundation, and Dr. Susan Kelly, the founder and director of Project Healthy Grandparents, as well as a professor in the School of Nursing at Georgia State University. Mary, I'm going to turn the program over to you now.
Great, Patty. Thank you. I am so pleased to have y'all on the phone today and to be asked to introduce Dr. Susan Kelly. Dr. Kelly has both a bachelor's and master's degree in nursing from Boston University and a PhD from Boston College in the area of developmental and educational psychology. She spent most of her career researching aspects of child maltreatment, including multi-generational families where grandparents are raising grandchildren. In addition to teaching in the School of Nursing at Georgia State University, she is the founding director of Project Healthy Grandparents. Project Healthy Grandparents is a research and community service program aiding grandparents who are raising their grandchildren in parent-absent homes. To date, Project Healthy Grandparents has served almost 800 families and 2,000 children. Jessie Parker Williams Foundation has provided funding to Project Healthy Grandparents for the past 12 years. I'm going to say a special thank you to Susan for preparing this presentation and joining us today. We look forward to hearing about how Project Healthy Grandparents has had an impact on the families and children it serves. Susan, take it away.
All right. Thank you, Mary, for that nice introduction. Good afternoon, everyone. I'm delighted to be part of this webinar, and I want to thank you for your interest in this topic. You know, it's a topic which is near and dear to my heart, not for personal reasons, but because of my professional experience. I'd like to go over a little bit about some of the statistics around grandparents raising grandchildren and to point out that this is truly a global phenomenon. It certainly in sub-Saharan Africa, it's a significant problem because of the HIV epidemic. On this slide here, I think you might guess where I am. This is, I had the good fortune to visit a very small village in rural Kenya about 5 or 6 years ago, where 50% of the children in this one village were being raised by grandparents because they had lost one or both parents to AIDS. And it was, it was just very emotional, as you can imagine, actually witnessing this. And they're attending a school offered by one of the sisters, and it was very interesting. I learned that the children, they go home for lunch even if there's no food at the house, because if they stay at school over the lunch period, the other children will tease them. That was just amazing. Also in the Caribbean, not too far from us, also because of HIV/AIDS, and there also the issue of substance abuse, there are many grandparents raising the grandchildren. And in some cases, the birth parents may have left their Caribbean island to come to the U.S. for better economic conditions. You know, we often think of the Caribbean as a place for vacation, but yet it really is part of the developing world. In Eastern Europe, some HIV/AIDS is not a large factor, but you do see significant rates of alcoholism and drug abuse, as well as parents who've gone to Western Europe for employment. In Asia, there are many grandparents who are almost full-time parents to the children, particularly if they live in a rural area and the parents go to urban areas for, sometimes 6 months at a time because that's the only place they can get employment. And then again, of course, us here in the U.S., we'll talk about that. In the U.S., there are 1.6 million children being raised by grandparents in parent-absent households. And the reason I emphasize the parent-absent is I'm not talking about families where the mother has moved back in with her mother and brought her kids. These are cases where the birth parents are not present and not actively involved in raising the children. Which is interesting that when you look at the numbers, because if there's over 1.5 million children being raised in parent-absent households, there are 500,000 children in the foster care, and many of them are placed with relatives. So we hear a lot about children in the foster care system, as we should. The needs are tremendous, but we have to remember there's a very large number of children that are in the care of grandparents who are not part of the formal foster care system. And 1 in 12 children are being raised by grandparents. There has been a very dramatic increase since 1990. Almost 80% increase since then. 173% increase since 1970. I want to be very clear that this impacts all racial ethnic groups and income levels. If I were in the room with you, I'd ask for a show of hands on how many of you actually professionally or personally know of a grandparent raising one or more grandchildren. And most of us do. And I've certainly met many professionals who are in this situation. Now, having said that, minorities and low-income families are disproportionately represented. Many of these grandparents are still in the workforce. They tend to be more likely to live in poverty than parent-headed families. Over a third have provided care for the children for more than 5 years. And if we want to break it down into the economics of it, that these grandparents are saving the taxpayers over $6 billion a year by keeping these children out of the foster care system. And when we think of the advantages of being with grandparents instead of the foster care system, it's really incredible. A child in foster care is likely on average to be moved every 18 months. When we think about that, what that is like for a child's development, they're more likely to retain ties to their racial ethnic group, or maintain ties to their religious affiliation and communities. So there's certainly the benefits. Other benefits are equally or more important than the economic impact. Because many members of this association are from the Southeast, I pulled some facts about the demographics and trends here in the Southeast, where the number of grandparents raising grandchildren is expected to grow. According to the federal government, the highest growth rates projected will be in Georgia, Tennessee, and North Carolina. Some of the contributing factors include regional poverty and rural methamphetamine use. Now, often people will say to me, well, Susan, you talk about these grandparents raising their grandkids, but aren't these really young grandparents? And not necessarily. 30% of these are age 60 or older. Now, if we look at a breakdown of all grandparents raising grandchildren, we see that 40% are Caucasian, Well, of course, I said that minorities are disproportionately represented. So this is 40% of the total population of grandparents raising grandchildren. So it still is disproportionately minority, because minorities do not make up. If you look at just African American and Hispanic, we know that they do not make up 50% of the population. Less likely in Asians, and only of all the grandparents raising grandchildren, only 2% are Native American. Now that reflects the overall number of Native Americans in this country, because the numbers there being smaller. I know we've got someone on the call from South Dakota. If you look at the Native American population or any of the Native American reservations, that there's a very large proportion of children being raised by grandparents, often because of issues of poverty, substance abuse. I know graphics and statistics can be boring. This is just meant to graphically portray the fact that if you are a grandparent-headed household, which is represented in the pink bar, that you are much more likely to be living in poverty, have less than a high school education, have a child with a disability, and the parent, in this case the grandparent, is much more likely to have a disability. And these are based on the U.S. Census data. So what are the reasons? They really do not vary much amongst the different economic groups and racial ethnic groups. They can include abandonment. This often takes place when a child is born in the hospital and the mother decides to leave without taking the baby with her, and often it's the grandparent who gets a call. We've had this happen many times, particularly in our public hospital here in Atlanta, and the grandmothers will tell us, I swore that if I ever got another call from that hospital, from the social worker or the nurse asking me to come pick up another grandchild, I'm going to tell them no. I just can't handle any more children. But guess what happens when they get the call? They go and they take that child in, because they know the alternative is that child's going to go to a foster family and not know his or her siblings. So they, more cases than not, they will agree to take that infant in. Abuse and neglect. Substance abuse plays a key role here, whether it's alcohol, illicit drugs, prescription drugs. And going along with substance abuse, we know, is mental health issues. And actually, that mental health issues often precede the substance abuse issues in anywhere in our population. So these two, it's often referred to as comorbidity, as you know. Incarceration, often the drug trafficking or the crimes that are associated with having the money to buy drugs often leads to incarceration, or one or both parents. Not so much in the U.S. anymore. HIV/AIDS has become much less of a reason why children are with grandparents, because we know that in this country, because of access to quality health care for most people, not all, that HIV is now more of managed as a chronic disease as opposed to a terminal disease. Some children end up with grandparents because of domestic violence, homicide, and not as often as military, but we do find military deployment, particularly in the past decade. Hopefully, many of these cases may be temporary, 6 months to a year at a time. However, when we read a lot about our returning veterans, we know that many of them do have PTSD, and some of them have significant mental health issues, which could be a reason why this is not a temporary situation. what are the issues that some of the grandparents face? And I include this slide here where they show a kangaroo mama carrying around a baby hippo. Because what you hear the grandparents say is that they just feel out of place, that their friends in their 50s and 60s don't really want to hang around with them that much because they've got a 2 or 3-year-old around with them. And then they say, when I go to the school, I go to the playground, I don't have anything in common with the younger mothers. So they often feel socially isolated. And you'll find situations where they may be going to the same church and not know that someone they know from church is also raising a grandchild. It's not something, because the reasons that they're in this situation are often so complex, people, we know people are not anxious to have to admit that their adult child has a substance abuse problem, has a problem with criminal activities. And so people aren't really anxious to make public what their situation is. They have many financial challenges. We talked about how that they tend to start off in poverty, more likely to start off in poverty. And then when you think of what the expenses are of raising children, I'm sure we have many mothers and fathers on the call, and I'm sure some grandparents who know how expensive it is. You don't begrudge it, but it does cost money to feed and clothe children. Housing is an issue because often people in their 50s and 60s have downsized, and now they have 2, 3 children moving in with them. And what do you do if you've got a teen boy and a teen girl? Well, certainly you can't have them share the one extra bedroom you have. So they find having to rent a larger apartment, having to try to buy a larger house, or having to move to a neighborhood that's less desirable so they can get more space for their money. Certainly psychological distress is something that they face. Psychological distress including depression, general stress as we know it, anxiety, and they're more likely to have health issues. What we have found working with our families is that the grandparents are more likely to put their own health problems on the back burner, so to speak, because they're so busy doing for the grandchildren. The children often have behavior problems, and we know that behavior problems in children really are a proxy for emotional problems. That's what, when children act out, it's usually because they are emotionally disturbed about something. And why wouldn't these children have emotional problems? When you think about it, they've been abandoned, neglected, sometimes abused by their birth parents. And so grandparents then need to learn to cope with this. Anybody on the call that either has adolescents or survived raising an adolescent knows that it's challenging enough. And then they've got to worry about drug use, teen pregnancy, violence. I mentioned they may have to move to a less desirable neighborhood for economic reasons, and often that is affiliated with crime. There are challenges parenting later in life. And some grandparents will refer to loss of the so-called golden years. Some grandmothers say, yeah, I planned, I live up north and I was planning on spending my retirement winters in Florida, but now that's not the case because I'm here with my kids going to school. And then, needless to say, they have challenges with their adult children. And as the saying goes, a parent can only be as happy as their least happy child. And so it's very hard on the grandparents when their adult child is involved in alcohol abuse, drug use, they have mental health issues, they've been in and out of rehab for chemical dependency. Some of these adults will steal from their own parents because they are so addicted. I had one great-grandmother who told me that she was raising her great-grandchildren, and it was her granddaughter, an adult granddaughter, that was their mother, and she would even steal things like pots and pans so she could go sell them. And it's just something I never thought of. You can realize people are going to steal cash or jewelry or silver, but something is like pots and pans. It's very sad. Incarceration we mentioned. I met one, well, it's not limited to one grandmother, but the actual person that led me to become interested and involved in this issue about 20 years ago was when I was doing research at the Children's Hospital in Boston, and I met a grandmother. She had 2 children with her. One was a 6-month-old, one was a 5-year-old, and she told me that their mother had been incarcerated and had been released 6 months earlier from prison, and she had no idea if her daughter was dead or alive. She never got into contact with her children or her mother once she got out of jail, and she also happened to have a very abusive boyfriend. And so you think of that kind of heartache for that grandmother to go around with. And she said, it's not so hard on the baby. She never knew her mother, but the 5-year-old is very hard to explain where his mother is. They certainly encounter legal challenges. Many of the grandparents do not have a legal relationship with their child. They may think just because the child lives with them, but we encourage at minimum that they get guardianship, legal guardianship of the children. Custody is an even stronger legal relationship. And then many grandparents will adopt. We also encourage them to do estate planning. Sometimes people who have few financial resources think they don't need a estate plan or a will, but they do. And also we help them with educational rights for the children. What are the grandchild issues? We mentioned abandonment and maltreatment. Sometimes the birth parent is in and out of their life. They may drop by every 2 months. And I would suspect that that's probably more traumatic for the children than those that have no contact, because if there is no consistency there. They certainly experience disruptions in their attachment relationships. They feel stigmatized and isolated. And this, we mentioned that increased chance of emotional problems, and this impacts their academic performance. So I'll move, now that hopefully I put this situation in some type of a context for you, I am going to move on to talk about our program that we call Project Healthy Grandparents. I was one of our grandmothers in the program. We started the program in 1995 to enhance the well-being of families where the grandparents are raising the grandchildren. Because research with all populations shows that the healthier that a parent is, the more likely there will be positive outcomes for the children. So when we started, it was really our major goal was to improve the outcomes for the children, but we knew we could only do this if we could also improve the outcomes for the grandparents. This is an ongoing research and community outreach program of the university. We use a strengths-based model. Our families are enrolled in the program for 1 year, where they receive the full complement of services, which I will go over shortly. After they are in the program for 1 year, they are transitioned, but they are still welcome to attend our group meetings. And during that 1 year in the program, our goal is to put them in contact with existing resources in their community. Now, here we are in Atlanta, and we are fortunate to have many community resources, and I'm sure we're more fortunate than some areas, particularly some rural areas where the resources are at great distances away. The families we serve are predominantly low income and African American. However, anyone of any economic level, any race, ethnicity is welcome into our program. The reason we have a large African American population is the geographic regions that we serve. We serve southern part of Fulton County and DeKalb counties, and these are the two counties that comprise the city of Atlanta for those that you are from another part of the country. The vast majority of the families are in informal kinship, or in other words, are not in the state foster care system, which also means they're not getting any resources, very few resources from the state. The average age of our grandparents is 56 years, and they range in age anywhere from 38 to 82 years of age. And most are over age 60, as with the national population I described. One of the reasons that we have a 20-mile radius around campus where we provide our services is because most of the services are provided in the home. And why is that? Well, a few reasons. One is transportation is difficult for our families. Public transportation in Atlanta does not go to every neighborhood by any stretch of the imagination. Some of them cannot afford to own a car. By going into the home, our nurses and social workers get a much better sense for the family's situation. And we consider it a privilege to be able to be in their homes in that regard. The social workers visit the families once a month at a minimum. They could be on the phone with the family 5 times a week. It really depends on what the needs of the families are. What are some of the things they do? Things you would expect. They help them if they have housing issues, if they have not accessed public assistance. The vast majority of our children are eligible for TANF child-only grants. And most of our grandparents are not eligible for TANF themselves. Social workers either provide counseling, encouragement, or make referrals for counseling. They help families learn to navigate the complex social service systems that are out there. Child care is an issue with many of the families, finding high-quality, affordable child care. Our registered nurses also go to the home once a month at a minimum. If a grandparent has a current health issue, the nurse will be out there as often as is needed. The nurses do health screenings and assessments on all of the grandparents and the grandchildren. We make referrals to health care providers. We make sure that the grandmother and the grandchild have a primary health care provider. The nurses also are involved with health promotion, preventive care, and help them manage chronic illnesses. We have one full-time master's prepared nurse who provides these services, and she also supervises graduate students who are RNs in obtaining their master's degrees at Georgia State. And so they become very cost-effective for us because at many universities, and including Georgia State, if you work as a research assistant, you often get your tuition covered by the university. So our students are willing to work for maybe a third as much as they would make in the hospital because of the tuition and getting that experience. And it's a real eye-opener for our social workers and our nurses, but the nurses in particular, because they're usually hospital-based, to really be out in the community and really see what families are encountering. And and how families have to make tough decisions. Do I buy fresh fruit and vegetables this week, or do I keep the electricity on? And those are some real decisions that people in economically challenged situations have to make. So they're less likely to judge people when they've seen what people have to contend with in their daily life. We also offer support groups, and this is one of the key services that we offer. We often have guest speakers that will come in and present on a variety of topics, and the grandparents draw so much strength from one another. I think we all know at different times in our life, whether it's an illness or we're a student or whatever the situation is, that it's our peers, our peer groups that often can be the most supportive because they know what it's like, whatever we're dealing with. And so they're wonderful to one another. We also offer parenting classes. When I started this back in '95, and some of my colleagues say, well, Susan, I think that's very arrogant that you're offering parenting classes when these grandparents have already raised children. And I said, this isn't my idea. This is what they asked for. What we hear over and over, raising children today is very different than it was 30 years ago. The world has changed. And also discipline, how to discipline children is an issue. And then what many will say is, how I used to discipline my own children 30 years ago is now illegal. I have to learn new strategies. So I always get a chuckle out of that. In other words, they can't spank their kid. They think, they know that spanking is not acceptable typically, depending on the age of the child and the amount I mentioned. We also are very fortunate that we have access to 2 vehicles that we raise through private donations to transport families to support groups, to classes, to healthcare appointments. We work very closely with Legal Aid Society and also with a private law firm, Kilpatrick, Townsend, Stockton. And in a little, before we close, we're going to talk about services and resources in your own community, but certainly partnering with either a private law firm or with a legal aid society in your area in order to let the parents know what resources are available for them. We also have early intervention services. Many of these children have been exposed to alcohol and substance abuse during their mother's pregnancy. And so we work very closely with the Marcus Institute and Emory School of Medicine to get in-depth developmental evaluations and then offer early intervention case management. I have to indulge and tell you about one of our former clients here. This is Mr. Ralph Johnson, and these are the 5 grandsons that he was raising. On his own, without a wife, without a girlfriend, he was their sole parent. And the significance of the baseball uniforms is important because Mr. Johnson used to play for what is called the Negro League, what's called the Negro League. And he played ball with them for many years, and of course he loved that. And we had a luncheon, and we had it at our local the Atlanta Braves Stadium because they gave us a 50% discount. So here's Mr. Johnson. We told him we were going to have a surprise for him. And what we did was we invited Hank Aaron. I know all of you baseball fans will know exactly who Mr. Aaron is, to the luncheon because they played on a team together for 1 year. They overlapped, but of course then Mr. Aaron was able to go to the professional leagues. So that was great, and I'll always, to the day I die, I'll remember the look on Mr. Johnson's face when I was able to say, Mr. Johnson, this is your surprise. He was so tickled. We use standardized measures for our program outcomes. I know that the foundation world is expecting this more and more, and it's not a problem for us because we're at a research university, so we love this part of the project, its outcomes. We use a pre-post-test design. We have an independent program evaluator, just skipping some of the details. What we have found using well-established measures, as that after 1 year in the program, the grandmothers are less likely to have high levels of stress. They're more likely to have improved health indicators, more likely to practice health promotion behavior. They're more likely to have accessed resources in the community, and they're also more likely to be empowered, because we don't do for our grandfamilies. We try to show them how to advocate for themselves. Because I have to realize that our families are very proud people. Some of them didn't even want to take TANF for their grandchildren because they've never taken public assistance. And these are low-income families, but they have always worked. For the grandchildren, we see improved behaviors in the children. Just to give you an idea of the population we deal with, that we have a significant problem with obesity and overweight, and that is, it's not something the Southeast, our region, is proud of, that we do have one of the highest obesity rates in the country. We try to work on that. Related to, I'm sure, to the obesity factor is a large percentage of diabetes, a large percentage of high blood pressure, and a large percentage report their health is only fair or poor. This is when they come into the program. They do report better outcomes because we're hounding them to get to the doctors. So we have seen improvements in blood pressure, in their cholesterol levels, and the nurses actually measure these. These aren't self-reports. And they're more likely to have gone for these basic screenings that probably you and I take for granted, that we're going to go, if we're a woman, we're going to go get our mammography, and we're going to, try to eat well. But we did see improvements in this. Again, we tell the grandparents, you have to take care of your own health. You can't always be self-sacrificing, because you need to be around to take care of your grandchildren, and that's what they want. That will motivate them. Okay, it's going to skip over. So in your own community, something that I get asked frequently, Susan, you look like you have all these resources. We don't have that kind of money to provide all those services. And what my recommendation is, if I had to start, and this is where I started with, one thing, it would be offering support groups, because you can reach so many people at one time and help them identify resources. Your local resources, your state AARP office. AARP, if you don't know, has been highly involved in the issue of grandparents raising grandchildren. They've got a great website with resources on it at their national level. The states may also. The Area Agency on Aging, these are federal offices. United Generations is based out of Washington, D.C. They have fabulous resources on their website. They also list state by state who are the agencies working with grandparent-headed families. Some states have what's called kinship navigator positions, where there are people that actually help grandparents figure out how to get what the services they need. Child Protective Services are helping in kinship, and certainly your United Way, local United Way may be involved, have services and resources to show you about. So our budget, this is our annual operating budget. It's you can see that it's $675,000. We're very fortunate. Our university funds 50% of our budget, and we were fortunate that the Board of Regents of the state of Georgia had an initiative for special funding, and we competed for this back in approximately 1998, and so that's the source of our funding. We also received 2 grants from Georgia Department of Human Services. We need to reapply for those every single year. And then the local foundations and donors, but really if you look at 25% of our funding comes from foundations and private donors, but of this 25%, probably 95% is coming from the area of foundations. We are so fortunate because the foundations in the Atlanta area have been extremely generous to us. Many foundations fund either social service or health care, and we, because of what we offer, we're eligible or a good fit with many of those. Some foundations want to fund children's services, so we are eligible, or the aging services, and we are often eligible for that. So these two slides will show you, I won't read, but you will see the various foundations that have funded us since the year 2008, and we are very, and if any of you are on the call representing these, we thank you. Obviously, Mary Judson's on the call with Jesse Parker Williams, which will be on our next slide. We're grateful to all of our supporters. And this is our website and my email address. If you, I know we'll have a little time now for questions and answers, but if you, after the webinar is over, you're welcome to go on our website. I will admit we need to improve upon it, but it has a lot of information. It is, any of you have websites, I'm sure most of you do, you know, it's constant. They constantly need to be updated. And then here is my email address at Georgia State. So Patty, Mary, that concludes my presentation. I thank everyone very much for their attention, and now I will leave it up to you two to have the question and answer session.
Well, thank you very much, Susan. This has been most informative. Do we have others with questions?
This is Lisa out of South Dakota.
Mm-hmm.
This presentation was right up my alley. I was actually on one of the reservations up here very recently, and I stumbled upon a project to provide caregiver training. The woman I spoke with, she kept saying, you know, there's a lot of grandparents raising grandchildren here. You know, they don't know what to do. So I guess I'm wondering, is there the data about reservations or Native Americans and Alaskan Natives, is there any state-specific data, reservation-specific? Because, I mean, Native Americans are very diverse.
Yes. Yes, and I'm not going to pretend to. I have visited reservations, but I'm sure you know quite a bit more than I do. If you go to the United Generations website, and they will have links to the U.S. Census data, where they break it down by state, by caregiver. They break down grandparent in household, and they also have grandparent raising grandchild. So you have to look for those two distinctions.
Okay, so you said United Generations is the website, correct?
Generations United. And this will be posted. This PowerPoint will be, you'll have access to that. So if you were just to Google Generations United, and you will come, their whole purpose is to deal with intergenerational families, and they have done fabulous work in this area. And you will find a link to the U.S. Census data on grandparents that will give you a state-by-state breakdown.
Excellent. I just found it. I typed it in backwards when I was first looking for it, but I just found the website. Thank you so much.
Oh, you're welcome. And maybe I said it backwards. Forgive me if I did.
Mm-hmm. Anyone else?
Yes, my name is Laverne Weathers. I'm calling from North Carolina.
Tina, go ahead.
Actually, I think someone else started to ask a question.
Oh, I'm sorry. I thought it was you. Who was asking a question?
I'm calling from North Carolina.
Oh, that's why I thought it was Tina. Go ahead.
I'm Laverne Weathers, and I work at a Department of Social Services, and we provide some services for grandparents raising grandchildren. But I was wondering about any information on other relative caregivers, because we have aunts and uncles certainly that are raising children. Are those numbers included with the grandparents raising grandchildren?
In my presentation, they were not included because we serve specifically the grandparents raising grandchildren, but there are places where you can access where they will say, and including the Generations United, where they would talk about grandparents and other relatives raising grandchildren.
Okay.
And I think that you will find, the issues, as you know from your work with these families, are very similar for the aunts and uncles and great aunts and uncles that are raising, raising relatives. They're very similar. You also, let's see, even a Google on just kinship care would probably bring up some resources for you. Generations United will have some information. The Child Welfare of America is another national organization that I'm sure has information on their website. Does that answer your question?
Yes.
Thank you. And Tina, we can take your question now.
Great. Thank you so much, Patty. Actually, I just had a question with regard to the nurses that are participating in the home visitation component. And I wondered if perhaps you could talk a little bit about the preparation that they're having to do more community-based care versus hospital-based care, just knowing that it's a more autonomous practice.
Yes, that's another very good question. Our master's prepared nurse, who's full-time, she has her master's degree in community health nursing and has 15 years of experience doing home visitation. And so she works very closely with them to let them know, issues about being respectful in someone's home, safety issues going into the home, what to expect in terms of, you don't control this environment like you do in the hospital. So they do receive very thorough training. We have a training manual for them. So yes, that's a good question because it is very different, and we just don't assign them families and let them go off on their own. They definitely need to be very aware of what the differences are and develop strategies.
That's great. And just a quick little follow-up question, if you don't mind. You had talked about the support groups that the grandparents have, and I just wondered with the nursing staff, do they also have kind of a support group of sorts?
Another good question. They actually, one nurse, our lead nurse, she attends all of the group meetings because this is the time when she can touch base with the grandparents in between their home visits, and she will have a blood pressure cuff right there to monitor their blood pressure, answer their questions, encourage follow-up. She does the intake, so she knows all of the families, even though she's not assigned as the nurse to all of the families, but she's familiar with all of them. But no, they don't have their own group per se, but part of the support groups and the parenting classes, the nurses will often suggest speakers on health-related topics, or they themselves will conduct something on a health-related topic. How to eat healthy food and still enjoy it.
That's great. Thank you. Yes, thank you very much, and it was an excellent presentation.
Oh, well, thank you.
Okay, we've got time for one more question. Well, this is fortunate that our questions and our time are coinciding today. So, thank you very much, Susan and Mary, for this very informative program about an issue that is prevalent in practically all communities. In about a week, we'll have this up on the SECF YouTube channel, and I'll send all the registrants the direct link to that recording. Please, as we sign off, don't forget to fill out the webinar survey as you leave the ReadyTalk site. You'll have approximately 5 minutes to answer a couple of questions, and if you do it in 30 seconds, that's okay too. Before we leave, I do want to tell you about our May program. It's called Aspire Arkansas, a statewide indicators report, and it's sponsored by the Arkansas Community Foundation, and their Vice President of Community Investment, David Johnson, will give the program. And it's about how Arkansas figured out, how the Community Foundation figured out what was needed in their community, and to think through how they would, as a community foundation, address these needs. So I hope you can join us for that. And thank you for being with us today, and hope to have you on the call in May. Thank you. Goodbye.
Bye.
Bye. Bye.
Thank you. Please stand by.